The two main keys to successful treatment with radioactive iodine are related to patient preparation measures. The first step has to do with stimulating your thyroid cells with adequate amounts of thyroid-stimulating hormone, which is made by the pituitary gland. Remember that the thyroid cell has receptors for both TSH and iodine? Without adequately stimulating the thyroid cells with TSH, the radioactive iodine won't be taken into the cells where it can then destroy the cell. There are two ways to ensure that a patient's blood level of TSH is high enough to allow treatment with radioactive iodine. The traditional way to do this is to have patients not take thyroid hormone for up to several weeks in order to allow the pituitary gland to slowly ramp up production of TSH. In these patients, the TSH levels in blood will be measured prior to treatment with iodine 131 in order to ensure that TSH is appropriately elevated. Patients undergoing this thyroid hormone withdrawal often experience symptoms of hypothyroidism that can have an effect on the perception of one's quality of life during this time. Patients report being cold and tired, for example. One benefit of this method is that it is significantly less costly than the alternative use of Thyrogen. The intramuscular injection of Thyrogen is the alternative to withdrawal from thyroid hormone. This drug is injected in 2 doses, usually 24 hours and 48 hours prior to administering the radioactive iodine. The advantage of using this technique is that patients can continue taking thyroid hormone up until and through the time of treatment with radioactive iodine, allowing them to avoid hypothyroid symptoms. On the other hand, it costs more to use Thyrogen to achieve the necessary elevated TSH blood levels compared with the withdrawal technique. As a result of this cost, some insurance plans may not cover this medication. The second main preparation step for treatment with radioactive iodine involves patients following a low iodine diet for at least 1 week prior to treatment and continuing for 2 days following treatment with radioactive iodine. The low iodine diet can be found in the literature given to you by the nuclear medicine department where you will be treated. These diets can also be found online at sites dedicated to thyroid cancer. Why is it important that you adhere to a low iodine diet? You may remember that in the beginning of this discussion, I mentioned that iodine is a building block of thyroid hormone. As thyroid cells are being stimulated to make hormone, they need to take in iodine to make this hormone. By giving you radioactive iodine and first placing you on a low iodine diet, we are substituting the radioactive iodine for the naturally occurring iodine in your diet. If there is non-radioactive iodine in your system, then it will compete with the radioactive version for the binding sites on the thyroid cells. This competition can decrease the effectiveness of the radioactive iodine in treating your cancer. Following a low iodine diet will therefore increase the chances of a successful treatment. Additional steps to ensure a successful treatment include not eating or drinking anything but water for about 4 hours prior to treatment with radioactive iodine and for approximately 2 hours following the treatment. If this is your initial post-surgical treatment with radioactive iodine, a 24-hour uptake measurement with a tiny dose of iodine 131 is often performed. We perform this measurement to determine how much residual thyroid tissue remains in your neck. Too much residual tissue could prevent you from getting the dose needed, and rarely patients will need further surgery to remove additional tissue prior to being treated with radioactive iodine. In some patients, especially those who are being treated for a reoccurrence of thyroid cancer, a whole body thyroid scan might be performed prior to additional treatment. This scan is performed a few days after a relatively low dose of iodine 131 and helps us determine if thyroid cancer has spread to areas of the body outside of the thyroid. Once treated with a large treatment dose of iodine 131, a whole body scan is usually performed up to a week later to determine where the administered dose of radioactive iodine localizes. Rarely on these scans we find that the cancer has spread to a place in the body we are not expecting. Let's now talk about what you can expect when you arrive for your iodine-131 treatment. You should receive information about what time to arrive for the treatment from the nuclear medicine department where you will be treated. Remember to arrive with an empty stomach other than water. Once you arrive, check in as per instructed by the nuclear medicine department personnel. If you are a premenopausal woman, then a pregnancy test must be obtained. Usually, the day before treatment, you will have received a trace dose of iodine-131 orally, which we talked about earlier. An iodine-131 uptake measurement will be performed in order to determine how much thyroid tissue remains in your neck. This is a simple test where a probe is placed in front of your neck for a few minutes. Then, unless you have consulted with the treating physician prior to your arrival, be prepared to spend several minutes speaking with the nuclear medicine physician who will be the one who prescribes your radioactive iodine treatment dose. Any questions that have arisen from viewing this video or other questions regarding your treatment should be addressed with this treating physician. Usually, the radioactive iodine dose that you will be taking will need to be ordered from the radiopharmacy after this consultation. Depending on the location of the treating facility, it can take up to an hour or more to receive this dose once the radiopharmacy receives the order. After the dose arrives at the nuclear medicine department, a technologist will escort you to the treatment area, which is called the hot lab. There, the technologist will verify that you are the correct patient for the dose in hand. The technologist will give you the iodine-131 dose that will consist of either a liquid or a capsule, either of which will be taken orally. After taking this capsule or liquid, you may leave the department and should immediately begin following the radiation safety precautions that have been explained to you. Before moving into the next topic and speaking about radiation safety, there are some general considerations for patients who are going to be treated with radioactive iodine. Iodine-131 therapy cannot be given to patients who are pregnant because of potential damage to the developing fetus. If you are a premenopausal woman, you will be asked to undergo a pregnancy test prior to treatment. A blood pregnancy test will be done on the day of treatment or 1 to 2 days prior. In addition, because a pregnancy test could be negative in the first several days after pregnancy begins, we recommend that you do not have unprotected intercourse for 10 days prior to your iodine-131 treatment. Iodine-131 therapy cannot be given to women who are breastfeeding or lactating. Breastfeeding should be stopped at least 6 to 8 weeks prior to therapy to reduce uptake of iodine-131 by breast tissues. Beginning a few hours after your treatment, it is important that you drink a lot of fluids other than milk, 3 quarts a day, over the next several days, as well as urinating as frequently as possible. The side effects of radiation have to do with how much radiation exposure you get, which in turn depends on how long the radiation stays in your body. By urinating frequently, including getting up every few hours the first couple of nights after treatment, you are decreasing your whole body exposure. We recommend starting the night of your treatment with iodine-131, setting your alarm every few hours. Keep a glass of water right by your bedside. When your alarm goes off, drink the water. Go to the bathroom, urinate. Go back to bed, and repeat that 2 to 3 hours later. Do this for the first 2 to 3 nights after treatment, and also urinate frequently during the day. Every time you urinate, you are getting rid of unhelpful radiation and decreasing your whole body exposure. Always double flush the toilet after urinating for the first several days. Because most of the radioactive iodine that you are given will be excreted from the body via the kidneys, patients with kidney failure should notify the treating physician of this issue. Occasionally, iodine-131 doses will have to be lowered as a result. Patients receiving intravenous iodine for medical imaging studies, such as CAT scans, should wait approximately 2 months before undergoing treatment with radioactive iodine. This large dose of iodine can stay in your system for long periods of time and will compete with the radioactive iodine, similar to dietary iodine. On the drive home, after receiving your radioactive iodine treatment dose, it is preferable that you drive alone. But if this is not possible, you should sit in the back seat as far from the driver as possible. The driver cannot be pregnant. For up to a month or more following iodine-131 treatment, you could set off radiation detectors at national borders, airports, bus and train stations, tunnels, bridges, trash collection sites, and even your place of employment. On a similar note, if you have a cold or another condition causing you to produce excess mucus, please flush any tissue contaminated with your mucus down the toilet. Don't place them in the garbage can because garbage trucks are monitored for radiation at the dump and can be held there until no longer radioactive. Also, these tissues can be a potential source of exposure to other residents in your household. It's important to have at least 1 bowel movement per day after treatment because some of the radiation is excreted from the body through the stool. Use stool softeners if necessary. It is well recognized that those diagnosed with thyroid cancer self-report a decreased quality of life compared to people without this disease. This may be due to the fatigue that is extremely common in thyroid cancer survivors. Fatigue is strongly associated with anxiety and psychological stress. In addition, thyroid cancer patients can often feel somewhat isolated and not part of the larger global cancer survivor network, partly because thyroid cancer has been associated with such an excellent prognosis. It is important that you and your healthcare provider monitor your psychological condition in the months and years to come in order to keep these symptoms in check.